Dr. Powell, welcome to the show. We're so excited to have you on today, and we're really excited to get into this episode. Welcome.
Well, thank you for the invitation. I love talking about healthcare data, the role of the CMIO. I am all yours with any questions that you want to explore.
Excellent. Yeah. And so before we jump in, just by way of background, can you give us a high level intro on your experience and background in the healthcare industry and a little bit about your current role?
Yeah, I've been in healthcare a long time. I started off as a physical therapist, went back, became a physician, trained at Duke as an anesthesiologist. And while I was there, it was the time period where the National Institute of Health and the National Library of Medicine uh, recognized that we needed more physicians that knew about data, knew about computers, and they offered a fellowship that I attended at Duke and got a biomedical engineering degree in medical informatics at that time period. And after that, I practiced as an anesthesiologist for a while and having a small role as an informaticist, and that began to expand. And then I became a CMIO down in Miami, Florida, and uh, led a Cerner install of the entire suite of tools that they do, got them stabilized, and then at University of Arkansas called, and they were doing an Epic installation, and so I became their CMIO and led them through that, and worked as a CMIO for about 10 years there at University of Arkansas. But towards the end, one of the things that we were recognizing as a big workforce shortage in both STEM, data, and informatics. And so that I was asked to start a clinical informatics master's and PhD program. And of course, you're probably aware now that there is a board certification in clinical informatics that physicians can pursue. And so we created a program around that also. Got that going. And then I have recently, I wanted to get back in the game. I got to admit that I miss hands-on, getting your hands dirty, fixing healthcare issues with good workflow analysis, good data analysis, and that's really my passion. So I took a job at uh, Aspirus Incorporated. We are reaching out and doing healthcare for rural areas of Michigan, Wisconsin, and now Minnesota. So we're growing and extending our reach to a very large footprint over a number of different areas, which is really, as you can imagine, taxes, our health record, our data, our processes, and our workflows. So it's the right challenge for the right time right now.